patch. Non-invasive method in disc herniation treatment. Lower back pain and neck pain account for the most prevalent disease for humans. Majority of lower back pain and neck pain is caused by disc herniation. It holds onto the vertebrae with its special fibers. Hernia, disc herniation, is a medical condition in which a tear in the solid structure outside the disc allows the soft gel-like portion to bulge out. If this bulging part compresses on the spinal nerves, emerging clinical case is called the disc herniation disease. ArtCure PV diffusional patch is an effective and safe treatment method due to its high clinical success provided in a short time and its low rate of side effects. It's an alternative to current treatment protocols. It's a new system that makes its effects so deep and naive as an art performance without harming. ArtCure PV diffusional patch is applied transdermally. The gel released through the patch acts in the herniated zone. Its mechanism of action includes decreasing regional intradisc density in the herniated zone and shrinking the current size. Patch ingredient rich nucleus pulposus together with formed carrier oils, Oleum limonis and Oleum rosmarini. It causes a substantial decrease in the volume and weight of herniated nucleus pulposus, which contains 80% water, by enabling the evacuation of water inside of it. Nucleus pulposus that lost weight and volume make less pressure on the nerve roots and the spinal cord itself. This results in clinical recovery. For 24 hours, the patient should lie flat on back and make bed rest in order to decrease the load on the disc. After 24 hours, the patch is removed from the body and the application is completed. The rate of reoccurrence of the disease is very low because anatomical integrity is not broken during ArtCure PV diffusional patch application. It is sufficient to use ArtCure PV diffusional patch for once. The second dose may be needed for some patients. This application can be repeated in 1-2 week time with the recommendation of the physician. It is required to be able to apply ArtCure PV diffusional patch. Application method is very quick after the decision is made, according to MR result. First of all, open the card box of ArtCure PV diffusional patch. Remove the primary packaging, leaflet, and 2 pieces of gel from the box. Pour the entire gel into the patch. Using the sterile diffuser, make sure that the gel is diffused thoroughly. Remove the applicators on the patch with the gel. Make sure that the porous section has contact with the skin. Make sure that the patch is aligned with the spine and positioned on the herniated area. Remove the protective paper on the hypoallergenic adhesive bands, which come in the card box, and place them to secure the patch. Use other bands to cover the patch, slightly overlapping them one on top of another. Around 100,000 patients in Turkey and in the world regained their health rapidly with ArtCure PV diffusional patch. ArtCure PV diffusional patch, non-invasive method in disc herniation treatment.